Everyone, welcome back to my YouTube channel. Study of cancer occurrence in population has contributed substantially to knowledge about its origin. The now well-established concept that cigarette smoking is associated with lung cancer arose primarily from the epidemiological studies. A comparison of the incidence rates of colon cancer or dietary patterns in the Western world and in Africa led to the recognition that dietary fat and the fiber content may figure importantly in the causation of the cancer. Major insights into the causes of the cancer can be obtained by epidemiological studies that relate particular environment, racial, and cultural influences to the occurrence of the specific neoplasm. Certain diseases associated with an increased risk for developing cancer also provide clues to the pathogenesis of the cancer. The following discussions first summarize the overall incidence of the cancer to provide insight into the magnitude of the cancer problem and then reviews factors relating to patient and environment that influence the predisposing cancer. For the year 2012, the World Health Organization estimated that there were about 14.1 million new cancer cases worldwide, leading to 8.2 million deaths, approximately 22,500 deaths per day. Moreover, due to the increasing population size by the year 2035, the WHO project that the numbers of the cancer cases and deaths worldwide will increase to 24 million and 14.6 million respectively. Additional perspective on the likelihood of the developing a specific form of the cancer can be gained from the national incident and mortality data. In the United States, it is estimated that the year 2016 will be marked by approximately 1.69 million with the new cases of the cancer and 5,95,000 cancer deaths. Incident data for the most common form of the cancer with the major killer identified and presented. Over several decades, the death rates are more for many forms of cancer have changed. Since 1995, the incidence of the cancer in men and women in the United States has been roughly stable, but the cancer death rate has decreased by roughly 20% in the men and 10% in the women. Among men, 80% of the decrease is accounted for by lower death rates for the cancer of the lung, prostate, and colon among the women, and nearly 60% of the decrease is due to reduction in the death rate from breast and colorectal cancer. Decreased use of the tobacco products is responsible for the reduction in the lung cancer death, while improved detection and treatment are responsible for decrease in the death rate and colorectal, female breast, and prostate cancers. The last half century has also been a sharp decline in the death rates from the cervical cancer and gastric cancers in the United States. The decrease in the cervical cancer is directly attributed to widespread use of the PAP smear test for early detection of this tumor and is precursorily on the development of the human papilloma virus vaccine may nearly eliminate this cancer in coming years. The cause of decline in the death rates of the cancer of the stomach is obscure. It may be related to decreasing exposure to unknown dietary carcinogen. Summary. Characteristics of benign and malignant tumors. Benign and malignant tumors can be distinguished from one another based on the degree of differentiation, rate of the growth, and local invasiveness and distant spread. Resembles the tissue of the origin and well differentiated, and poorly or completely differentiated. To be slowly growing versus to fast growing. Circumscribed, have a capsule, and have poorly circumscribed and invade the surrounding tissues, and localized and not localized. Basically, these are the points. Here is the synovial lymph node is the first regional lymph node that receive the lymph from the primary tumor. It can be identified by the injection of the blue dyes or radiological tracers near the primary tumor. Biopsy of the synovial lymph nodes allowing the determination of the extent of spread of the tumor and can be used to plan treatment. Although the enlargement of the nodes near a primary neoplasm should arouse concern for the metastatic spread, it does not always imply cancer's involvement. Thank you so much for watching the video.